Ladies and gentlemen, welcome back to another episode of the Diary of a Trainee Psychological Wellbeing Practitioner, the Diary of a Trainee PWP. And this is going to be episode 6 with regards to week 6, the 6th week. So the week before, we finished our OSCEs and I had, 2 days off. And I literally, or about 2-3 days off I had, and went to Spain, as I mentioned in week 5, went to Spain, went to Barcelona as a bit of a break, and it really does help. And as I mentioned towards the end of week 5, yes, it is important that we do invest in part of our well-being. We do invest in our well-being, and part of that is traveling, getting some time out. It's not just outside the country, but even within the country, but to different areas outside town and etc. Getting out of town really does help, especially a huge city like London. I mean, yeah, it really does help. Seeing a lot of greenery, new weather and etc. Now with week 6, let's get to the point. Week 6, we entered the second module. So the first module, which is known as engagement, looking at the screening stage, which is the triage, then looking at the assessments. So that assessment, problem-focused assessment, that second stage, we're coming to an understanding, knowing what exactly are we meant to look at in order. It's like the introductory towards treatment. And here we go into the second module, which is all about how do we set up treatment now. So after we're done with the triage, after we're done with a problem-focused assessment, now we're setting the whole treatment program. We're setting the sessions, we're setting that intervention. We know what the problem is, we know what we're going to focus on, we know the goals, and then after that, now we know the intervention, we know the techniques, we know what we're going to do. If it's to do with low mood and depression, we know that we're going to look at behavioral activation. If we know that it is to do with excessive worry, anxiety, particularly what we call generalized anxiety disorder or symptoms of generalized anxiety disorder, GAD, that's the acronym, or excessive worry, that's another way of calling it. We know we're going to work on worry management, that's an intervention, and the techniques we're going to be working on that. If we're going to be dealing with panic, we're going to be dealing with, specific phobias, then here we're going to look into exposure or graded exposure therapy. We're going to use that as an intervention. Also, what is also important that I want to mention here is, what we were learning that week and entering the second module, which is setting up treatment. What is the role of a PWP? It is therapy. It's treatment. It is part of therapy. But what is also interesting, and this is something that started to make sense to me, because I was wondering, after you graduate and you qualify as a PWP, I remember that in 2020 and 2021, during the pandemic, that obviously you got lockdowns, remote therapy started to become, or remote interventions, remote treatment, remote therapy started to become the big thing. So they started to have graduates and qualified PWPs, when they qualified in 2019, 2020, 2021, particularly 2020, 2021, there were a lot of job positions that were called tele coach, or a mental health, like a tele coach or something like that. And then I started to understand, what they've been trying to tell us is that your role is similar to a coach, where you are actually giving a way of therapy, but you're using some type, you're kind of like coaching clients on how they can build a toolkit, a self-management toolkit that will help them in their recovery. Because sometimes we get a bit conflicted over here. It's a misunderstanding. What does a therapist do and what does a coach do? There is therapy, but we're using coaching tools in the therapy and in the treatment. So we help people to develop and build self-management techniques, a toolkit for self-management in order to manage their problems, overcome their distresses, and finding the best coping mechanisms and dealing with that specific problem that they want to focus on. Again, the also reason why this is more of a coaching role is because the duration is shorter than other types of, or most therapies. So with PWPs, being low intensity CBT therapists or CBT practitioners, our sessions are half an hour, 30 minutes. When it comes to the high intensity therapists, so these are the people who are dealing with moderate to severe, and their training is also at a higher level. Here they're dealing, they're going into 45 minutes. Some of them maybe even longer than 45 minutes to an hour. So that's at that level. And that level of that's at that level. Sorry, I'm losing my train of thought, but I'm trying to get back. So that's something that we need to know, and that it's, we also learn that how many sessions are we giving? We're giving 6 sessions. High intensity in others, it's usually high intensity can go up to 8 and beyond that. So with us, it's 6 sessions, 6 weekly sessions, and we make sure that we get them recovered to the level best. Unfortunately, over the last number was almost 13 years since over 13 years, almost 15 years now, if I'm not mistaken, 15 or 16 years since IAPT was first established, there's been a significant recovery rate of 50 plus. It's been 50% plus recovery rate on an annual basis. So a lot of people are getting that recovery, specifically if they finish the course of treatment. But we learned a lot about that. How do we set treatment? The different interventions, our role as PWP, what is our role? And also learning about something called the stepped care model. What is the stepped care model? There are about 5 steps, particularly when it comes to mental health, and that is in terms of each step is, who do you go to for help? Who do you go to for help? Now, this step care model, I believe it can be used even in other healthcare settings, but let's say I'm talking about mental health. Your step 1 is your GP, anyone around that, your GP, your healthcare provider. If you're going to a hospital, a doctor or whoever it is, that's at this, hospital, clinic, mainly your GP, that's your healthcare provider. That's at step 1. Yeah, you're going to them. Then when they refer and they can see that there are mental health problems, they refer. Who are the next people in the next step? Step 2 is us, the PWPs. We're at step 2. We're at the low intensity. But when they come to us, what happens is this. We do the screening. We do the triage, which is like a screening sort of session. And then from there, we understand, is our service the right service for them? Yes or no? Do they need to be signposted to other services? Do they also need to be stepped up to the higher step, like step 3, where you have high intensity therapists, so high intensity CBT therapists over here, and then you've also got counselors at that step 3 level. And all of these stepping up, it all depends on the two things. It depends on the severity of their conditions, their problems. So if it's mild to moderate, we can deal with them at step 2. If it's moderate to severe, then they're going to need to go up probably to step 3. If the severity increases, coupled with the risk, the risk. It's not just the severity of the condition, but it's also how intense and how severe is the risk. Couple that together, it might need to go to step 4, which are now the specialists, the mental health specialists. They might need to go to specific therapists who do specific types of therapies. They might need to go to counseling psychologists, clinical psychologists who are more specialized. Then it goes up to probably, if higher the severity, here they need like really like an in-depth type of treatment program that step 3 can't deal with. So if they can't deal with it, then it needs to go up to step 4. Then step 5 is institutional. I don't want to say that word. I was going to want to say institutionalization, but I don't want to say that. I want to say maybe they need to be hospitalized or admitted. This is where it reaches to them actually needing to be hospitalized. They need to be admitted, and they need to be in that inpatient sort of environment in order for them to receive the right treatment, because they've reached to a point where they do need to be admitted. So it really depends on 2 things: severity of the condition and the problem, and also severity in terms of their risk. Remember, in terms of their risk. So when you're looking at risk, what are you looking at? Risk to themselves, the ability to harm themselves. So self-harming and ending their life, suicide. Number 2 is harming others, or the intention, the planning, and etc. And then also self-neglect. Reviewing their safety is essential. So these are some of the things that we went through in week 6.